What is up, guys? Welcome back to Patho and Chill. Today we're going to be talking about a very itchy childhood disease that if you got it, you probably already know what I'm talking about. That's right, chicken pox, also known as Varicella. Let's get started. So to get started, this disease belongs to the family of the herpes viruses, with this one in specific being the Varicella-Zoster virus, also known as a human herpes virus 3. So then how is it acquired? Well, say like you were probably a little kid that your parents took you to daycare and there was some other kid within the daycare that probably had it and spread to you via an aerosol, so like an air droplet or just direct contact, right? So then once you acquire the virus, the incubation period of it is about 10 to like 21 days. Throughout the incubation period, you probably won't be feeling anything because it's barely starting to get into your cells, replicate, etc. But once it's established, then that's when the symptoms will begin. And as I'm sure if you didn't get it, then you probably knew someone that got it, and the symptoms come with a very itchy rash. Now, this itchy rash will start all around like the trunk of your body and then slowly spread to the extremities. And like we've been saying, it's extremely itchy. So it appears a red rash, and one will find multiple blisters throughout your body. And once these blisters ulcerate, then that's when it becomes super itchy. So then one will really tend to scratch them. And then as they progress, they will start to crust. The thing with scratching them is that they can potentially lead to scarring. So that is why it's very important that if you're a child or if you have a child with chickenpox, that you do not let them scratch their lesions. If scratched and infected, it could lead to complications such as encephalitis, so that's like inflammation of your brain, or pneumonia. There's another complication called Reye syndrome. So that is another reason why we really want to stay away from scratching these lesions. Aside from this very itchy rash, one will experience malaise, so that's when the body starts to feel like you're getting sick, you don't feel well. You'll get rhinitis, runny nose, pharyngitis, a sore throat, all these prodromal symptoms that we've talked about in previous videos. These are also very common. So far we've been talking about the symptoms that appear on your skin, but we also have symptoms that appear in the oral cavity, and these appear as many ulcers anywhere in the oral cavity. Oftentimes they will be found in the vermilion, that is your lips, the palate, or the buccal mucosa, that is the inner part of your mouth where you have your mucosa lining. Okay, so now let's talk about treatment. So this disease will likely just last for 10 to like 14 days, and you really don't have to give anyone any type of antivirals. However, there are antivirals that will reduce the symptoms. There are also various skin ointments that you can apply to your skin to reduce the itching. However, the majority of the time, you're just gonna have to be supportive to the child. Give them whatever, if they have a lot of ulcerations, give them food that is not too hard. If it's very itchy for them, make sure they're wearing more like baggy clothes. You don't want your clothes really touching all those lesions around your skin. One thing many parents do is give their kids like kitchen gloves at night, so then whenever they're going to sleep, they're not scratching around and it doesn't lead to scarring or any other possible complications that we've been talking about. However, if you didn't get it, it's likely that you had the vaccine. So this vaccine comes in 2 doses. It's given at a very early age. This vaccine has about a 90% efficiency. Now, it is likely that you've heard of shingles being related to chickenpox, and that is right. Chickenpox, also known as varicella, commonly occurs at a young age, but there is a recurrent infection that happens only once in your life known as shingles. Now, we're going to talk about this in a later video because I don't want to make this video too long, but it is definitely important to know that there is a recurrent infection. So once you do have chickenpox, you'll likely experience some other type of symptoms at some other point in your life. With that being said, thank you guys for watching. Make sure you guys stay posted for that second part where we'll be talking about shingles. For now, please drop a like, subscribe, and peace out.